In the interview segment, we conclude the conversation which my colleague Gloria started with Professor Isaac Adewole on the nation's healthcare system. He talks about the Save 1 Million Lives project, as well as other government policies to improve the health sector.
Professor Isaac Adewole, welcome to the program.
Thank you so much, Gloria.
The federal government would roll out the Basic Healthcare Provision Fund. Am I correct? Exactly, later this month.
Yeah.
And we're wondering, what is this all about? Many Nigerians don't exactly know what's the difference between Basic Healthcare Provision Fund and maybe other, other funds that, the sector receives. I know the sector receives a whole lot of interventions. And then we're wondering who, again, are the beneficiaries?
Without sounding too patronizing, the Basic Healthcare Provision Fund is a unique component of the healthcare system in Nigeria. Federal government passed the National Health Act in 2014, and a key component of the National Health Act is the provision of at least 1% of the consolidated revenue for funding the healthcare system.
Which we don't have yet.
Hold on. You must give kudos to us again. We've approved it, it's in the 2018 budget. We've also made provision again in 2019. Not only that, we have spent a long time developing the manual. We're working on a document that will last for decades. We are not only working for today. And so we're laying a solid foundation for modernizing the Nigerian system. And this administration, this president will be credited for being the architect of the modern health system in Nigeria. What would the Basic Healthcare Provision Fund do? Simply put, for the first time, we will make sure that we provide resources at primary care level. When we spoke about improving 10,000 PACs, the critical question is, how do we keep and make sure that these primary care centers survive? And Basic Care Provision Fund will guarantee resources to the PAC. 45% of these resources will be channeled to the Primary Care Development Agency, 15% of it for human resources, 20% for commodities, including vaccine and drugs, and 10% for human resources. Very unique arrangement. 50% will go through NHIs for the procurement of services at primary and secondary level. That act empowers the Honorable Minister to prescribe a set of basic services that Nigerians will enjoy. And I've done this to include malaria, immunization, family planning, antenatal care, delivery services, including cesarean section, will be free to Nigerians. So we are on to making sure we deliver health as contained in that manifesto and the promises Mr. President made to deliver health to our people.
What would be the criteria for those who should access this fund, and then how would the monitoring process be?
Good. We've spent a long time trying to work on the monitoring process. We have many of the partners working with us. There will also be an independent verification agent that will be put in place. We agreed that this could include the universities so that they can actually monitor what is happening. And I'm quite excited. Osun State Governor has just announced an improvement committee that I will personally chair that will see to the modernization of 332 PACs in Osun, 9 general and state hospitals. So things are happening.
Because it sounds too good, to be true.
And you must credit this administration for being innovative, for being bold, and for being progressive.
Is this sustainable?
It will be sustainable.
In spite of any government?
In spite of any government. Woe betides any future government in 10 years' time that will stop this.
So you're saying the states have keyed into this?
Perfectly.
Because we know we have issues with state governments who simply gulp funds and don't get the job done. I know a lot of I know some agencies who have actually complained about how funds go to states. I know that initially we had this 1.5 billion distributed to states.
Million?
Million.
That's the same 1 million life.
Exactly. Nothing literally happened to those funds.
Gloria, I think that would be a sweeping generalization. That would be unfair to many of the states. Many of the states use this money well. Where it has not been used, let me give you an example. Edo State has used maybe just about 1–2% of this money, 2.5 million dollars. I had conversation with the governor and he said, Honorable Minister, I want to make sure that we overhaul the delivery system. We want to make sure this money is well utilized. So it's not being squandered.
How many states utilize that money?
At the last count, I can tell you that not less than 30 of the states have used the money.
How would you verify it?
I have data.
And you have the projects to show for them?
Yeah. Because it's meant for improving primary care, and some of them could use it for other things. The beauty of the money is that we're giving it as a seed fund for them to get more money. So no state will not want to use it, because if you don't use it, you won't get more.
How many have more? I understand the more is supposed to be 20.
No. At the last count, Yobe is going to get about $28 million in terms of improvement. Zamfara got 9 million in 2017. Osun is going to get 20. So many of them. FCT maybe about 7. So they are going to get more. So it's a question of using it to improve what you have. When we send the team to measure performance and improvement, then we'll give you more.
So far you've given how many states more?
I don't want to guess, but in the first year we gave 1.5.
Yes, that was for
we gave
all the states.
Another one. In 2017, 14 states got more.
How much more?
It varies from $300,000 to, I think, the highest was 10.
What was the level of satisfaction you got before giving them more?
We measured improvement, and the data is there for you to see.
What is the improvement? Because we have reliable information that money was squandered.
That's not true, Gloria.
I made my findings.
If you have your findings, work with us. We have the Secretariat of Save 1 Million Lives. There is data. We've just released the data from the SMART survey that gave performance. On what we did was to compare the performance in 2018 with performance in 2015, performance in 2018 with 2017, and data will not lie. So we will let you have a copy of this data, and you can go through it.
What is your plan to curb medical tourism?
At the last count, we're looking at why do Nigerians go out of the country? They go out for 3 reasons. 1, for cancer care, for renal diseases, and for cardiac. And so we are doing a modernization program in these 3 areas. Right now, we have 2 LINAC machines assembled in National Hospital Abuja. It's probably the only hospital in Africa that has 2 high-energy LINAC machines. One was in the crate for 3 years before this administration came on board. We installed it, its service is working, and we treat about 100 people every day with cancer.
For how long?
Daily. It's going to be there for many years to come. We got the second one from SNEPCO, and that is by January should be ready to fire. So that means National Hospital alone can treat up to 200 people every day. We are building bunkers for the first time in Ibadan and Zaria, and we are going to buy 2 energy machines for them. We are buying brachytherapy equipment for Benin, for Enugu, for Sokoto, for Abuja, for Ibadan, as part of this improvement program. I think we're doing really well to make sure that we cover grounds with respect to these diseases. And we hope that as we support our tertiary institutions, the need to go abroad will be reduced.
You complained some months ago about how over-dependent states are on the federal government when it comes to tackling, issues like outbreaks and the rest of it. As I think you went as far as saying that because the issue of doctors, has become really critical and the states are not helping out. What's the situation right now?
I thought we addressed this earlier on, Gloria. You asked me whether we're engaging the states. I said yes. Are the states cooperating? I said yes. The issues right now is that in Zamfara, where in fact there were 22 doctors last year, Zamfara has employed over 100 doctors.
So now you have rescinded. It's no longer states are not cooperating, they are cooperating.
They are, but it's a progressive thing. But I can tell you that things are happening.
Well, Professor Isaac Adewole, thank you very much for your time.
Thank you, Gloria.
Abuja. Thank you.
Thank you.
Let me thank you for your mails and tweets. As always, keep sending in your views and comments using the email address and Twitter handles on your screen. Also, be sure to share anything happening within your locality. Don't forget, you can view the program on youtube.com/channelsweb youtube.com/videos. Thank you for watching. I'm Ibrahim Adra. We'll see you again some other time.